We can prevent 90% of heart disease with just pure lifestyle changes. Yet, we choose to spend 90% of all the money treating heart disease on end-stage procedures and hospital care.
Welcome to the Girlfriend Doctor Show. I'm your host, Dr. Anna Cabeca, and I'm here to talk about a really important issue that affects all of us, and it is the #1 killer of Americans today and worldwide. The #1 killer for both men and women, and many women don't realize this, but the #1 killer in women is heart disease. And it shows up differently than in men. It's like this, we call it oftentimes the silent killer, because you don't know you have it till disease has been going on for a long time, and then you're symptomatic. And so we've got to figure out the underlying ways to do that and to prevent and reverse, I'm going to say that again, reverse heart disease. And that's what we want. Wherever you're at, it's not a death sentence. We can reverse heart disease, and we've seen it over and over again. And I encourage you to join me in this discussion, and we're going to hit some really key pearls from the 4 key ways that he works to address heart disease, what the modern medical approach is, what to really focus on from that and embrace, and what maybe needs to be fine-tuned or trashed, right? And so as a clinician, as an expert in this field, as someone who's been working for over decades helping people with heart disease and hypertension, this is important information for you. So I'm glad you're here. I am so happy to have this time with you.
Well, Anna, it's always a delight to get to talk with you.
What's really important is that, like in your writing, in your clinic, in your practice, in your life, I mean, you walk the talk 1000%. Again, I've been in your kitchen. I've seen you, love hanging out with you and your beautiful wife, Nicole, and your family. And being in your clinic too, it is just amazing that you've been so data driven. So not only do you know the research, do you know the food as medicines, you come from a nutritional perspective, but clinically you watched people heal from coronary vascular disease. So I want you to talk about why the heart is so important, and this entire issue with cardiovascular disease, and why also we're going to get into. But you guys, right before we started, Dr. Masley was like, the gut microbiome is getting that healthy is so much more important than your cholesterol number. And so just let that sink in for a second, because that is just a powerful statement. Because what is our, world always doing? Our medical system's always like looking at your cholesterol and looking at your numbers. So, and managing that, and it's supposed to increase our quality of life and longevity, but it really doesn't. So, all right, I'm so excited to talk to you about this and the new research.
Well, as you said, the heart is super important. For men and women, heart disease, it's still the #1 killer for Americans today and for most of the Western world. So I think many people, especially women, underappreciate how big a factor it is in their health. I think most people are aware that heart disease is the #1 killer for men. And most women actually think that breast cancer is probably one of the #1 killers for women. But for every 1 woman who dies of breast cancer, 6 women die from heart disease. So they're both important, but I think heart disease is a huge issue from what we die from. But it also impacts, as you know, how we live. Your circulation impacts the perfusion of your tissues, which means your energy, your vitality, how well you feel. It also, as you and I have discussed many times, your circulation determines sexual function. It's kind of obvious for men that if they don't have good circulation, they don't have good function. But for women, it's critical for sensitivity, for lubrication, for all those issues that are important for enjoying sexual function. So,
well, I want to harp on that a second, because we got to talk about this, because erectile dysfunction is a symptom of heart disease. And it's a huge symptom of heart disease. And it is so true. And men are going untreated. They're just getting, I mean, it's important to manage your blood pressure, but they're just getting their blood pressure managed and their cholesterol. And they're not addressing the underlying issue, even to the extent of, like a simple recommendation, like work out at the gym 4 times a week, doing high intensity interval training. Let's just start there or somewhere, right? Because that circulation is such an issue. But as a gynecologist working with women in my medical practice, what I, seeing the changes with aging, and from that loss of good blood supply, we see the vaginal dryness, the loss of the elasticity of the vagina. And let's just talk about clitoral atrophy. I mean, I know everyone on my podcast is like, oh, there she goes again, the most important real estate of the body. She's going to talk about it. And it's so true. It's so true. But it happens on it happens just like it happens to men, and it starts happening a lot sooner for women.
And it's really underappreciated that circulation is, yes, hormones have an impact, but the circulation impacts the cellular function of your tissue, and whether you're thriving, flourishing, or dwindling. And my goal is to avoid dwindling. It's sexual shrinkage. We don't want that.
Oh, no. No. Yep, I'm with you on that. And so let's talk about how a standard workup is to preventing heart disease. And this really, no pun intended, but this is a subject really dear to my heart. I mean, I went into medicine because at age 16, I remember coming home from school one day and my house was empty. Normally my mom was there cooking up a storm. Everyone, the neighborhood kids would come with me because there were sure to be cookies or something yummy baked and ready straight out of the oven for us. And the house was dead quiet. And she was 52 years old, undergoing coronary bypass surgery, 3 vessels. And at that point it was, and heart disease runs on both sides of my family, but specifically my mom's side in 40s, 50s, certainly. And unfortunately she died prematurely at 67, undergoing a second heart surgery. And so that really took me in this trajectory of understanding and trying to understand more of what happened in this situation. So I want to just quickly address signs and symptoms of heart disease in women and men, but so signs and symptoms of heart disease and the current way it's worked up, and then we're going to address how we believe is the right way to work it up and address it and reverse heart disease.
Well, the standard approach today is we look at a few risk factors: cholesterol, blood pressure, or blood sugar, and we put people, and if those aren't at target, we put them on drugs that make them feel worse. And then we wait for something bad to happen. We're not measuring function or artery age or anything else. Sadly, and I'm being a little cynical here, but it's the reality of our situation. We wait for something bad to happen: a heart attack, a stroke, death, or some need for a major procedure. And those procedures, as both of us know on a personal level, can be either have major consequences or deadly. So to me, that's just totally backwards, that we can prevent 90% of heart disease with just pure lifestyle changes, yet we choose to spend 90% of all the money treating heart disease on end-stage procedures and hospital care. We might spend 9% on drug therapy and measuring cholesterol, blood pressure, and blood sugar, but we only probably spend 1% on prevention, but we could prevent 90% of all heart disease and make people feel so much better with the right lifestyle changes. So that's my goal, is to turn that 1% of where our focus is to the 90% and help anyone who's motivated feel fantastic, improve their energy, their quality of life, their sexual function, and prevent heart disease. I mean, that's easily achievable if we know what to do.
That's a huge statement. Definitely want people to share this statement, because that your quote, we can prevent 90% of heart disease. I mean, that's huge. We can prevent 90% of heart disease. and increase the quality of life that we see all the way around, and the quality of healthy relationships. So let's talk about the signs and symptoms of early heart disease.
So, I mean, the classic one we hear about is angina, chest pressure. And for men, that's actually true. They'll get pressure in their chest, short of breath, nauseated, maybe dizzy. But women really typically don't get that classic angina pattern. They just might feel short of breath when they're out working, or they just might feel fatigued. So they experience it differently, and they're oftentimes misdiagnosed. But let's face it, if we're waiting for that level of symptom, it's really late.
It's really late.
Sign is sexual dysfunction. As we lose circulation, men and women have sexual dysfunction. So if men are having erectile dysfunction, oftentimes the doctor just pats them on the back, gives them Viagra, doesn't even think that their arteries are being clogged, and this could be reversed and prevented. That's, I think, the reality. But for women also, if they're getting dryness or decreased sensitivity, less sexual enjoyment, that's oftentimes a sign of decreased circulation. So I would change that around and look at our risk factors differently. One, I would start having people measure their artery plaque age. How old are their arteries with ultrasound? And assess that. Something you've seen me do in the office, in the clinic. And I would be looking at factors that are super important, like nutrient intake. What food should we eat? What food should we avoid? As you mentioned, exercise, and it's about fitness, being fit, that high intensity workout that gives you fitness, and stress management. Those are the things that are super important and make a dramatic difference in how we feel and how we live.
Deborah thought she'd never be able to enjoy sex again until she tried Julva, my all-natural anti-aging cream for your delicate feminine parts. She had tried all sorts of herbs and oils and even estrogen, but nothing worked as well as Julva to rejuvenate her feminine bits and bring fireworks back into the bedroom. Well, find Julva at dranna.com and use the code SHOW10 to get 10% off your first order.
But our research showed that more important than measuring your cholesterol or even your blood pressure, the two risk factors that to me are the most important are your blood sugar and your blood pressure. Blood sugar determines whether you're, burning up tissues, whether you're growing plaque, and whether your brain's shrinking. So blood sugar is the number one cause for heart disease. A measure of function of your arteries is your blood pressure. If your blood pressure is not it should be less than 120/80 without medication. If not, you're probably growing plaque at an accelerated rate. And oftentimes the doctor says, oh, your blood pressure is elevated, but you're fine. No, you're not fine if your blood pressure is elevated. Your arteries are sick and something's wrong. And you can change that with nutrients, food, and activity and stress management. So, and then probably the third really critical thing that's new, that if you'd asked me about this 10 years ago, I would have been unaware of it, but the gut microbiome, those bacteria and bugs in our gut, have a big impact on heart disease. So to me, those are the three critical factors: blood sugar, blood pressure, and gut microbiome, that really influence our risk for heart disease and our circulation. So yes, cholesterol has some small effect, but that's far less important than I think these other factors.
That is such a powerful statement, because it's harped on cholesterol, and we know we can lower it too much, and we need to look at the full panel of it and see what's happening, because we need cholesterol to make our testosterone, to make our hormones, to make our DHEA, to make our, we need that testosterone. Thank you for watching this video. Be sure to subscribe to my YouTube channel here and get those notifications, and comment below. Let me know your thoughts, what you loved, and what your action step is.